Hi, I'm Amy. I'm one of the people who help take care of kids here at Helen DeVos Children's Hospital. During this video, I'll show you around and talk to you about what you need to know before your surgery and what will happen while you're here. The first thing I want you to know is that your mom, dad, grandma or grandpa, or whomever brings you to the hospital will be close by. Now, let's talk about what happens before you get here. We'll call your parents to remind them of the day and time you need to come to the hospital. We'll also ask questions about you and your health. These same questions will be asked many times while you're here. We just want to make sure we have all your health information so we can take very good care of you. We'll also remind your parents that you need to have an empty stomach before we can do your surgery. That means you can't have any food or drink. That includes water, gum or candy, before you come to the hospital. So remember, when you brush your teeth, be careful not to swallow any toothpaste or water. The nurse will go over the details during the phone call with your parents. The night before you come to the hospital, take a shower or bath before you go to bed. Then get a good night's sleep. The next morning, when it's time to come to the hospital, you can bring a book, a favorite blanket, or one of your toys. When you get to the hospital, we'll get you ready for surgery. We'll find out how much you weigh and see how tall you are. Check your temperature and listen to your heartbeat. We'll check your blood pressure. That feels like a hug around your arm. You'll get to wear a light-up sticker on your finger while we check your oxygen. We have special pajamas for you to wear. You'll also have time to play or relax. You can stay in your room, or you can check out the toys and games we have in our playroom. When everything is ready, you and your parents will go to meet your doctors and your nurse in another room, where we have more fun things to do. You'll meet a doctor who is an anesthesiologist. Their job is to help you go to sleep for your surgery, take care of you while you're sleeping, and wake you up when your surgery is all done. Your other doctor is a surgeon. Their job is to do your surgery. Your doctors will talk with you and your family and answer questions. Next, we'll take you to the room where we will do your surgery. You may walk or take a ride on a bed that has wheels on it. It may be a little smaller than your bed at home. Everyone in the surgery room wears hospital clothes, hats, and masks. This helps keep the germs out, so the room stays very clean. It might be possible for one of your parents to come with you while you go to sleep. If they do, they will wear hospital clothes too. The nurse will talk to your mom or dad so they know what to expect. When you're in the surgery room, a nurse will put stickers on your stomach and chest. These stickers are connected to a monitor that tells the doctor how well you are breathing and how your heart is doing while you are asleep during surgery. Kids come to the hospital for all different types of surgeries, and they all go to sleep before their surgery. It's different than when you go to sleep at home each night. You won't have to try. We'll give you medicine that does all the work for you. Sometimes we help kids go to sleep with a mask, and sometimes we help kids go to sleep with an IV. We'll talk more about IVs in a minute. If you go to sleep with a mask, it will look like this, and it goes over your nose and mouth. It will feel soft and comfortable on your face. You will still be able to breathe and talk with this mask on. The mask will be connected to a tube right here that will give you a special air that you will breathe or smell. Your eyes will feel tired and then you'll fall asleep. Some kids say this air is a bit stinky, so if you want, bring some flavored chapstick and the doctor will rub it on the inside of the mask. It won't be on the part of the mask that touches your face, but the chapstick will help the air smell better. If you go to sleep with an IV, it will look like this. An IV is a very tiny tube that goes into a vein. This part of the IV has a small needle inside to help guide the tube into the right spot. When the IV is in place, we will throw away the needle and only the soft part will be left. This part will be taped to the top of your hand to keep it in place until it is time to go home. We can use a special cream on your skin so you won't feel it so much. The doctor will give you medicine through the tube and you will go to sleep for surgery. If you go to sleep with a mask, you'll have an IV too, but the doctor will put it in once you are already asleep. Through the IV, we can send medicine and extra water directly into your body while you sleep. During your surgery, your parents will be in the family waiting room, which is close by. As soon as your surgery is done, the doctor will let your parents know how you're doing. When you start to wake up, your parents will come be with you in the recovery room. Some kids wake up fast, and others feel tired most of the day. Sometimes your stomach doesn't feel good. If you feel thirsty, you can have some small sips of water, and later, if the nurse says it's okay, you can have a popsicle or some Jell-O. When the nurses think you're ready, they'll take you back to your room to rest before you go home. If you need to spend the night, you and your parents will be taken to a new room in a different part of the hospital. The nurses will continue to check your temperature, blood pressure, and oxygen many times. When we're sure you're feeling okay, we'll get you ready to go home. A nurse will take off the tape, then slide out your IV. You'll get to pick a fun Band-Aid. A nurse will let your parents know how to take good care of you. When you're dressed, we'll walk you and your parents to the door and say goodbye. We promise to give you and your family the best possible care. If you have any questions, ask anyone at the hospital or tell your mom or dad and they can ask for you. You might want to check out some books about going to the hospital or look at the kids page on our website at devoschildrens.org. It's a good idea for you and your family to come take a tour of the hospital before your surgery. It really helps to see everything for yourself with your mom or dad. We look forward to meeting you here at Helen DeVos Children's Hospital.